Hi my amigos, my name is Cedie and thank you so much for watching this video. And for today, we're going to have another lecture discussion on some mental disorders, giving you the signs and symptoms, the diagnostic criteria, and the treatment plan for every disorder. I hope that this video is useful for you, and please, if this is your first time to visit my channel, please do subscribe at my channel and hit that bell button for you to get notified whenever I post a new video. Hi everyone, so let's have another discussion for today. Let's have abnormal psychology. Let's discuss anxiety disorders. So this is the very common disorder under the clusters of mental illnesses. Okay, so but first and foremost, let's define anxiety. So anxiety is a feeling of worry, nervousness, or unease about something with an uncertain outcome. So anxiety is defined as an apprehension over an anticipated problem. Okay, so we all know that fear is a reaction to an immediate danger. Okay, so but both involve physiological arousal, anxiety and fear. So anxiety disorder is a chronic condition characterized by an excessive and persistent sense of apprehension with physical symptoms such as sweating, palpitation, and feelings of stress. So this triggers the body to have that experience of fight or flight. As for sometimes people say that anxiety is a shadow of intelligence because when you feel anxious, you try to do more better, you try to exert much effort. Anxiety increases preparedness. Okay, this is the moderate levels to improve performance. Under anxiety, we have various classifications. We have panic disorders, generalized anxiety disorders, phobic disorders, obsessive compulsive disorders or OCD, post-traumatic stress disorder or PTSD, and other related disorders. So just take note about this. These are the six, all right, part of the classification under the anxiety cluster, under anxiety disorders. Okay, let's move to generalized anxiety disorder. What is this? So generalized anxiety disorder or GAD, okay, this is usually characterized by chronic anxiety, unrealistic and excessive anxiety and worry that is uncomfortable to the point of interfering with the daily life. Okay, a person with GAD or general anxiety disorder worries excessively and feels highly anxious at least 50% of the time for 6 months or more. Okay? So, most common psychiatric disorder, ang anxiety, 28% report the anxiety symptoms. Alright. So, excessive worry or anxiety about the multiple issues which linger 6 months or more can indicate generalized anxiety disorder. Okay, so we have again 6 months for us to classify or diagnose that it is general anxiety disorder. Alright, what is the etiology of GAD? As with many mental health conditions, the exact cause of general anxiety disorder isn't fully understood, but it may be included genetics as well as other risk factors. So they include personality, a person whose temperament is timid or negative or who avoids anything dangerous. Okay? Are prone to generalized anxiety disorder. Genetics as well. So generalized anxiety disorder may run into family. And being female, women are diagnosed with generalized anxiety disorder, okay, much more than men. Mental condition, okay, here are the mental conditions associated, all right, to individuals who suffer from generalized anxiety disorder. Abnormalities in the hypothalamic, pituitary, adrenal, and hypothalamic pituitary thyroid axis. All right, so acute myocardial infarction, okay, and so on and so forth. So anxiety disorders, we have general criteria. So I will be discussing. Number one is symptoms must interfere with important areas of functioning or cause marked distress. The symptoms are not caused by a drug or a mental condition, and the fears and anxieties are distinct from the symptoms of another anxiety disorder. So, again, we have a lot of classification under the cluster of anxiety disorder. So, in order for a person to be classified as GAD, all right, those should be present. Signs and symptoms of generalized anxiety disorders. So, the symptoms fluctuate. You may notice better and worse times of the day. Right? So, bago-bago siya. Not everyone with generalized anxiety disorder has the same symptoms, no? But most people with GAD experience a combination of a number of the following emotional, behavioral, and physical symptoms. So, emotional symptoms such as constant worrying, running through your head, feeling, okay, you have the feels like your anxiety is uncontrollable. There's nothing you can do to stop it. Intrusive thoughts about the things that makes you anxious. You try to avoid thinking about them. There is an inability to tolerate uncertainty. You need to know what's going to happen in the future. There is a pervasive feeling of apprehension or dread. Okay, here are emotional symptoms for generalized anxiety disorder. Let's go to the behavioral symptoms of generalized anxiety disorder. Inability to relax, enjoy the quiet time, or be by yourself. Difficulty concentrating or focusing on the things. Putting things off because you feel overwhelmed. Avoiding situations that make you anxious. Alright, take note of those. Physical symptoms of generalized anxiety disorder is feeling tense, having muscle tightness or body aches, having trouble falling asleep or staying asleep because your mind won't quit, hindi ka makatulog, feeling edgy, restless, or jumpy. Okay, also stomach problems, nausea, and diarrhea. Ayun. So, ICD-10. Okay, so we have also, it is also classified, no? So ICD-10 under the coding F41.1, generalized anxiety disorder. Okay, note that for children, they have different criteria. Okay, a period of at least 6 months with prominent tension, worry, and feelings of apprehensions about everyday events and problems. That is number 1 criteria. Number 2 criteria is at least 4 symptoms out of the following list of items must be present, of at least 1 from 1 to 4. So, ayun, these are some of those symptoms. Automatic arousal symptoms. We have palpitations, pounding heart, sweating, trembling or shaking, and dry mouth. Symptoms naman concern to chest and abdomen. We have difficulty breathing, feelings of choking, chest pain or discomfort, nausea or abdominal distress. Ayun. Symptoms concerning the brain and the mind, feeling dizzy, unsteady, faint, or lightheaded, feelings that objects are unreal, derealization, or that oneself is distant or not really here. There is depersonalization, fear of losing control or going crazy or passing out, fear of dying. Okay, and general symptoms includes hot flushes or cold chills, numbness or tingling sensations. Symptoms of tension, we have muscle tension or aches and pains, restless and inability to relax, feeling keyed up or an edge of a mental tension, and a sensation of a lump in the throat or difficulty with swallowing. Alright. Other non-specific symptoms, we have exaggerated response to minor surprise or being startled, difficulty in concentrating or mind going blank because of worrying or anxiety, persistent irritability, difficulty getting asleep because of worrying. Okay, so difference between normal worrying and general anxiety disorder. As they say, it's normal to worry. Okay, so we can differ here. Ano ba yung pagkakaiba ng dalawa? How can we say that the behavior is already considered to be generalized anxiety disorder? So if your worrying doesn't get in the way of your daily activities and responsibilities, ayun, it's still normal. But it's considered to be bad if you're worrying significantly and it disrupts your job, activities, or social life. Okay, it's normal when you're able to control your worrying, and it's abnormal when your worrying is uncontrollable. It is normal when your worries, while unpleasant, don't cause significant distress. It's abnormal when your worries are extremely upsetting and stressful. It is normal when your worries are limited to a specific small number of realistic concerns. It is abnormal when you worry about all sorts of things and tend to expect the worst. It is normal when your bouts of worrying last for only a short time or period. It is abnormal when you've been worrying almost every day for at least 6 months. Okay. So, diagnostic criteria for GAD. To help diagnose generalized anxiety disorder, your health provider may do a physical exam, okay, order blood or urine test or other tests, ask detailed questions about your symptoms and medical history. You can use psychological questionnaires to help determine a diagnosis. Alright, so let's go to the DSM-5 criteria for generalized anxiety disorder. This includes, number 1, excessive anxiety and worry about several events or activities for most days of the week for at least 6 months. There is a difficulty controlling your feelings of worrying. The anxiety or worry that causes you significant distress or interferes with your daily life. Okay, this should be present, no? For it to be considered as generalized anxiety disorder. Okay, so generalized anxiety disorder often occurs along with other mental health problems. Okay, so yun, we have also phobias. Okay, we have specific phobia marked and disproportionate to fear consistently triggered by specific objects or situations. Okay, we also have the panic disorder. Ito yung at least 1 month of concern about the possibility of having panic attacks or worrying or recurrent uncued panic attacks. We also have depression. So this is a mood disorder, okay, affecting the brain. We also have substance abuse, okay, and post-traumatic stress disorder. All right, the symptoms of this disorder should be on the 6 months time frame. Alright, the treatment and drugs for generalized anxiety disorder are psychotherapy, and there is also medication. Okay, it's good to benefit from the combination of the two. It may take some trial and error to discover which treatment works best for you. Okay, so counseling sessions are very helpful for people who have generalized anxiety disorder. And psychotherapy or the talk therapy, no? Working with a therapist, okay, to help you reduce the anxiety symptoms. Okay, CBT as well is one of the most effective forms of psychotherapy for generalized anxiety disorder. Okay, we have medications. Drugs used for GAD will be benzodiazepines. We also have buspirone, okay, alpidem, and tricyclic drugs. Alright, so I believe benzodiazepine are the most common one to be used, as well as diazepam. Okay, ayun. Alright, so that's the end of our discussion about generalized anxiety disorder. I hope you've learned something from. And that's all for today, my egos. Thank you so much for watching. I hope you share this to others, and don't forget to subscribe.